topic for today is how dining services are used to support health and wellness programs. A couple of months back, as I was researching the article that accompanies this webinar, I came across a couple of reports that really put the topic in perspective for me. And in case you haven't had an opportunity to download and read the article yet, I'd like to point out a couple of quotes. A March 2011 Thomson Reuters Workforce Wellness Index report stated that unhealthy behaviors of the U.S. workforce cost employers an average of $670 per employee annually. And when you consider the size of the workforce represented, even just by the participants on the call today, the numbers are truly staggering. Here's another. In a report entitled Employee Health Engagement, identifying the triggers and barriers to engaging employees in their health benefits and wellness programs, the Midwest Business Group on Health stated, convenience is a major factor for those who lead a hectic lifestyle. The challenges employees indicate they face include finding time to eat healthy, cook healthy, and be physically active. I think this really defines why we're here and having this webinar today.
So again, these slides do speak for themselves, but if we look at 1990, can see that we have a lot of shades of blue there. The prevalence of obesity at that point was less than 10%, and no state had a prevalence of greater than 15% population obese. As we look at then 2000, we have less blue and more of the tan color. And in that ratio, it's 20 to 24% of the population of the state had a prevalence of obesity. And by 2010, we don't have any shades of blue at all. No state had a prevalence of obesity of less than 20% at this point, and 36 states had a prevalence of greater than 25%. 12 of them actually had a greater incidence of 30% of that dark red. So reviewing some of the impacts in relation to these trends in just the diet portion, we can see 2/3 of our American population right now is overweight or obese. Even more staggering is the rate that we see in children and adolescents. That's from age 2 to 17. That has tripled over the last 3 decades. And with that, we see more early onset diseases that children shouldn't get, such as adult onset diabetes. In 2008, there were some statistics from the USDA that said medical costs associated with obesity were estimated at $147 billion. I'll go through some other numbers as we move on, but we can see that as the obesity rates skyrocket, we see more prevalence in early onset disease and unhealthy people. So it's really, unfortunately, becoming more common to see more obese people, and it's quite costly. So here, just reviewing some of the factors of our typical American diet. According to the USDA, healthier diets could prevent at least $71 billion per year, including medical costs, lost productivity where you miss work, and lost lives. And that's only in a figure that we're referencing, heart disease, stroke and cancer, and diabetes. Just obesity alone is estimated to cost $117 billion. So, what are we going to do? We can't stop eating. It's not a choice like, choosing not to smoke or even not to exercise. The typical American diet that's high in processed foods is very energy dense and not with the right energy, very high in saturated fats that can clog your arteries, high in sodium, and high in sugar, especially simple sugars such as high fructose corn syrup. So there's really long-term complications with the style of energy-dense processed food type diet. We can see a decreased lifespan with poor nutrition, decreased productivity, and right now the future appears to have an overall lower population of well or healthy people due to poor eating habits and lifestyle choices. Nutrition in You is a survey done by the American Dietetics Association, which is now called the American Academy of Nutrition and Dietetics. They've done 8 surveys since 1991. The objectives are to measure current attitudes and behavior towards diet and health and identify attitudinal and behavioral trends toward diet and health. What we see here from the most recent survey results in this one question where people were asked, are they doing all they can to achieve balanced nutrition and a healthy diet? There hasn't been a huge shift in this answer to this question since 1991, from about 44% saying they are to 2011 it's about 48 or 49%. What doesn't connect there is the obesity trends that we saw earlier, where it continues to grow, yet people feel that they're making a strong effort to eat healthy and do all that they can. Another question in this survey asked, how do people get their nutrition information and health information? And the most common sources were TV, magazines, and internet. The question to ask is, are these reputable sources? You know, what are the nutrition and health claims that they are promoting when they're looking at these sources? Are they promoting vitamins, diet supplements, health supplements? Are they promoting packaged foods? You know, when we think about ads you see on the TV, we don't see ads for, you know, broccoli and apples and those sort of items. For example, as well, for the money that the government has in promoting health in their most largest nutrition education program, the 5-a-day program, that has an annual communication budget of about $3.6 million, whereas someone like McDonald's spends 1,000 times more than that on advertising and promotions at $1 billion. And then following up as well with the first slides with the obesity trends since 1960 to 2000, a lot of that just speaks for itself, but to highlight, say, soda, that one right there is a difference of about 150 calories from back then in the 60s to about 6.5 ounces was your common portion to 20 ounces now. So that's about 10 packets of sugar. And numerous studies that have come out show that the larger the portion that's put in front of you, the larger that you will eat. So if you're given a bowl of pasta that's 3 cups, you'll likely eat 2.5 cups. If you're given a pasta entree that's 1.5, you'll likely eat a cup. So here, just to wrap up, opportunities to influence employee health and wellness, looking at the quality of food you choose, focusing on the fresh, whole, unprocessed foods, education, from qualified professionals and reputable sources, and really focusing on behavior change of your clients and population that come to your facilities, on portion control and providing healthy dining choices.
So today I'll be talking with you about the benefits of wellness integration with food services that we've experienced by sharing a number of real examples within MediFit managed locations across North America. So the first question you should ask is, why is integration important? Essentially, both functions have a high level of contact with your employees, and they're a very visible part of their work experience. Essentially, your wellness investment is maximized when these partners collaborate to bring a broader set of resources together than they could do alone. And your employees benefit too because they're exposed to a more cohesive and supportive experience. One promising practice that I'd like to share shows commitment to your employee by having your wellness team meet with new employees and tour them through your building or campus to highlight the health supporting benefits that they're interested in, such as healthy options in the cafe, the on-site fitness center, working mothers' rooms, or the on-site clinic. And they also use this time to talk about other health benefits of the health promotion program, such as the health risk assessment, online health portal, nurse line services, or any other offerings that's included as part of your health management program. When thinking about how to approach wellness and food services, you can start by asking 2 questions. First, what tools can you provide to employees to help them make healthy lifestyle choices at work? And then also, how can you surround them with multiple opportunities to be as healthy as possible during that work day? We found that the work environment provides a very unique opportunity to be creative and to help employees to learn and practice skills for improved behavior. So if you look at the screen and you start at the top photo, working clockwise, imagine for just a moment if you had the following offerings available to you at work. cooking labs, where the chef shows you how easy it is to plan for and prepare healthy meals. You get to sample the delicious final product, and you leave with recipes in hand. Sensory displays, where you can test your current knowledge about nutrition and learn about portion control and flavorings through hands-on experiences. Supermarket and cafe tours, where the wellness team meets you at the local market to point out food labeling or how to select the freshest produce, or 10-minute tours in the cafe where you learn about healthy option labeling, substitutions that are available, and even how to ask for them when it's your turn in line. At one company, nearly 800 employees learned about food choices that fit into a healthy eating plan for good health by using this vehicle. Wellness on Wheel carts, or WOW carts for short, where wellness comes to you in your department or in hallways with nutritional hands-on learning. Wellness fairs, where you learn through interactive displays and discussions at each booth, which is a distinct shift away from health fairs that used to focus on grabbing and bagging a brochure. Lunch and Learns, where experts provide an open forum for questions on health and wellness. Better yet, many locations now offer learning on the move formats, otherwise known as walking lunch and learns, where you increase knowledge and steps while walking through or near the cafe, by the medical clinic, and past wellness displays. At one large manufacturing location where time is limited, what we found is that by offering walking lunch and learns, about 11% of the site population participates. What's interesting is that 62% of participants are not fitness center members. So we're really attracting a different group to these walking lunch and learns. And how about community-supported agriculture, where you purchase shares of locally grown fruit and vegetables that are delivered directly to the work site, and you receive recipes from the cafe that encourage you to try new ways of preparing the produce at home with your family members. The next area is really focusing beyond those education and skill builders. What we found is that it's important to offer a mix of activities where employees support each other and hold each other accountable for engaging in healthy behaviors. Peer support has a very powerful influence on behavior, and we found that when people form friendships as a result of their healthy behavior, they're much more likely to sustain it. So we strive to offer a number of diverse and fun offerings that build on the concept of strength in numbers. You can offer group walks where staff lead quick 7-minute walks that take you on a designated course, again, by the cafe and other gathering spots. At one site, nearly 200 employees change into sneakers and walk the indoor ramps during break times. They report that these short bursts of activity leave them feeling re-energized and more alert. And cafes help by providing coupons to compliment participants for their healthy actions. Or maybe you'd like to offer group fitness classes such as Zumba or yoga, but you just don't have the space. In these situations, we partner with the cafe and facilities to host on-site classes by temporarily relocating tables. Wellness and cafe teams co-host 15-minute rejuvenation stations multiple times throughout the day next to cafes on campus. You learn basic yoga techniques, and you receive a complimentary energizing tea at the end of the session. We also use the time to talk about chef's choice entrees in the cafe that complement the tea being served on that particular day. It's very important for wellness to tap into the human touch that food service representatives can provide to socialize programs. We very much believe in collaborating to provide education, a little bit of training, so that the reps that engage with employees through those food lines know the types of offerings that are available to employees to help them to be as healthy as possible. For example, blood donations increased by 49% when an integrated approach was deployed. The team socialized the event person to person, which is by far our most effective promotional vehicle, including personal reminders from staff working the registers during checkout. We find that a little bit of training goes a long way. Recently, 15% of eligible females participated in on-site mobile mammography. Wellness champions wore pink to generate interest in breast cancer awareness, and cafe staff handed out pink ribbons to help to promote registration. At a recent flu shot clinic, 54% of employees received their vaccination while at work. The cafe helped to promote the event by providing reminder cards during checkout and a gentle verbal nudge to remind the employee that flu shots were happening. Some of our most effective Go Red for Women promotions have occurred when each cafe food line offers a healthy entree that is obviously marketed in advance that meets American Heart guidelines. And cafe staff wore red shirts during the promotional period to get people talking and asking questions about what's going on. And also, we believe in offering other opportunities that really link to policies and business practices or use visual cues and space to make behaviors easier. For example, meeting energizers. Does your company have a policy where healthy options must comprise of a certain percentage of catered meetings? Embedded into the ordering process is the option for wellness staff to provide an energizing stretch break or a themed activity to the group, or active meetings. At one company, department managers lead the way by having their team join them for walking meetings so that it's now become the norm. Others offer bike loaner programs where you bring your own helmet and you sign out bikes for a ride on the local trails. So you may be asking, how is food services connected to these activities? At many locations, the cafes make the activities, as Rob talked about earlier, as convenient as possible by strategically placing fruit baskets around the building, and users provide a nominal donation towards replacement costs. They also offer grab-and-go services where healthy options are prepackaged to reduce wait times in cafe ordering lines. Some also offer lunch-on-the-run services where you can pre-order and prepay for your lunch, and it's held in a designated location in the cafe for quick pickup, or refrigerated in the on-site fitness center for same-day pickup. We all know the importance of encouraging stairwell use by making them as appealing as possible. And I love this one. One company uses humor. In this case, the stairwell says, in case of a big lunch, take the stairs. To launch the improved stairwells, staff handed out healthy treats and no elevator pledge cards. In one morning alone, 440 employees signed pledges to use the stairs instead of elevators. What's great is you can replicate the same messages in stairwells in parking lot signage, which is used as a nudge that helps to make healthy decisions fun. One company sent out email blasts talking about the benefits of taking more steps during the day. And during the final week of promotion, employees were encouraged to park farther away from building entrances. Over 200 people immediately parked in spaces earmarked as the farthest away and were entered into a raffle hosted by the cafe, and a celebration as well. The next day, participation increased another 18%. Some other examples that I just wanted to show you on the screen are of how wellness and food services work together include tools to applaud healthy behavior. If you look in the upper left-hand section, you've been caught doing something healthy, recognition cards, where cafe and wellness staff reward employees for doing something healthy after the fact. And they receive some sort of nominal reward for that behavior. Loyalty cards for purchasing healthy options in the cafe, and also wellness challenges where you're encouraged to set a wellness goal, have a blood pressure check, try a healthy meal in the cafe. And other integrated wellness programs that I've shown are weight management. We offer some breakfast clubs at some locations, stress management, smoking cessation, and healthy eating programs. At one company where employees work on oil rigs offshore, 99% participated in a team-based nutrition program. The integrated program was so successful that the rig is now serving fresh produce that's never been requested before. So finally, a little bit about how to get started with integration. First, it's important that you communicate, as the employer, integration expectations with both internal and external partners. Even better is if you facilitate bringing these partners together to share your company objectives and expectations with the larger group. You want your partners to develop a shared vision and have the mindset that every opportunity is one to support each other in a meaningful way. It often starts with talking about contracted deliverables, unique workplace challenges, and then identifying opportunities to work together to break down those silos. And many of those silos is where we're replicating programs so that we can overcome these barriers, and essentially that each partner is successful in the end. One last success that I'd like to share with you is that both MediFit and Unidine worked in partnership to submit an industry award application for our mutual client. As a result, our client was awarded by the American Heart Association as a fit-friendly company, which recognizes them for creating a culture of physical activity in the workplace and one that goes above and beyond when it comes to their employees' health.
We implemented our wellness program back in 2008, first creating a brand for the program. We wanted to use the Ocean Spray tagline of Brand for Life, so we came up with the Fit for Life wellness program name. We wanted our employees to be healthy ambassadors of our healthy product. Our Fit for Life mission is to encourage healthy lifestyles, resulting in happier, healthier, and high-performing employees. And our program also encompasses all aspects of health and wellness, including physical, mental, and financial. Really, to create a culture of wellness is a collaborative effort between Ocean Spray and our vendor partners. We have an on-site wellness coordinator with +1 Health Management who is responsible for program design, scheduling, and meeting with our employees. Our program also consists of different components from our various vendors, like our medical carrier, disability, EAP provider, our benefits consultant, Unidine, and then organizations in the community, such as area hospitals and other providers. So getting the message out and communicating throughout all our locations is always a challenge for us. We have both corporate employees, like I said, and then nationwide employees. So corporate-wide, we do provide a monthly newsletter on wellness and benefits that contains wellness tips, benefits information, recipes, and monthly programs. We're also able to offer seminars at each location based on various topics. We also offer a program called Wellness on Wheels. This is where department managers can request a wellness seminar of their choice, and we will have that delivered during a staff meeting. Some of the company-wide challenges we have done so far include physical movement programs, such as a Move 2010, the walking program, and then weight loss challenges, such as the Biggest Loser, Biggest Winner. Those types of company-wide challenges provide, peer support and a social outlet for the employees. Some of our corporate programs involve wellness consultations, nutrition course, group exercise classes, on-site massage, acupuncture, and then cooking demonstrations. So our collaboration with Unidine has really taken off in the past couple of years. It's been very helpful in the way we connect our wellness efforts with everyday choices that employees encounter. The willingness of the on-site chef to be creative and open to our suggestions has been really crucial in our process. You have to tie things together, so you can't be, asking employees to exercise and eat better and then bring them into the cafeteria where the least expensive option is a cheeseburger. Our regular weekly Fit for Life menu selections are indicated on our weekly menu, and there's signage at the food stations. Our menu selections include the soup, salad, deli, grill, entree, and a value meal selection, and all are created to be lower fat, lower sugar, higher protein, and higher fiber. These menu selections are collaborated on between the Unidine chef and our wellness coordinator. And then we've also customized the catering menu so that when people are ordering meals for meetings, they also have the same healthy options. So some things that, we're looking in the future as we continue our partnership with the cafeteria. We continue to have a struggle with vending machine support. Our corporate office is the only location that does have a cafeteria. All the others are manufacturing locations with vending machines, and they all have their own individual vending machine. And our challenge is how do we connect these and offer the same selection and choices across the board. Some other opportunities, we want to look and see what people are buying in the cafeteria, how often are they buying the Fit for Life items, and which ones are the most popular. We want to continue integrating our wellness programs with the cafeteria options. We have a Smart Way wellness program for weight loss, and the cafeteria ties in an entree of the day with that program. Another thing that the cafeteria does is they'll put Weight Watcher points on certain entrees. We also want to, take an opportunity to periodically review the cafeteria layout. We want to make sure we're visually promoting the healthy options and keep changing it up. We also have on our agendas to have all the materials have a single look and feel, and that would be including the weekly menu, the daily food station signs, et cetera, to all have that integration between the cafeteria and our Fit for Life brand. Developing a culture of wellness is slow and it takes time, but we have definitely seen steps of that occurring. People are talking about the food options. They're excited about it. They've shared personal experiences about getting in shape, losing weight, and really feeling that the company is supporting their efforts.
How do you demystify the subject matter so it's something everyone can understand? I think the general consensus is that, society's speeding up, and everyone's busy, and everyone's running in directions and trying to get everything done that they need to get done, and very often we fall into a rut and end up making convenient and not proper decisions. And that's an unfortunate change in our society, but I think in something that we do and what we offer, we can sort of help change that. Why is an integrated approach to nutrition, health, and wellness such a challenge? And I think it's a very complicated question. Accessibility is very important. I think cost, especially in certain economic cycles like this, we're all cost conscious and risk averse if we're going to take a financial risk. And then what are the best steps to get back to basics and meet the increasing demand for this integrated style approach? The most successful way that we've found is really communication, understanding the culture and the needs at all facilities at all levels. Unidine's commitment to being the industry leader in food and dining management services. That's it. It's a simple approach. We have a singular focus, and that's food. Our goals are to partner with clients that truly see a value in a provider that will collaborate with and deliver on their organizational, employee, customer, and guest wants and needs. What makes our approach truly a point of differentiation, I think, is we take what we do seriously, and we feel as though we have a responsibility to take the confusion, the burden and stress of delivering on healthy nutrition away from our clients. You want to focus on running your business, and it's our responsibility to allow you to do that. Our ultimate aim is to support your organizational and cultural goals and allow you to provide a world-class employee, guest, and client experience. We've heard this term come up, convenience. I think there's a big difference between convenience and convenience. Our primary focus is to provide delicious, nutritious foods that are convenient, that are accessible, that are not convenience-based. Our responsibility is to understand the market opportunities and make educated decisions on your behalf. Running our kitchens with talented, trained chefs is a focus, priority number one. I think our operating principles differentiate our product offerings and therefore reflect our health and wellness desires. We're a real food company. We use natural ingredients, and we use sound culinary applications. This is the foundation of what we do on a daily basis. I think if, as a consumer, if you shop in a cafe or you shop in a retail environment, there are opportunities to find convenience foods, whether they're prepared salads or prepared dressings or soups or deli meats or bakery goods. We don't all have the culinary experience or the time or the desire to prepare all these things ourselves from scratch in our own homes or make them at home and bring them to work, but that's our responsibility. I think generally this is where the challenge lies in a lot of the balance between what is convenient and what is convenience. And our real goal is to provide you convenient, healthy, fresh, scratch-based options. Our integrative approach focuses on things being accessible. Healthy food options need to be affordable. They need to be sensibly affordable. I think from a healthy item perspective, many healthier items are nutrient dense. Therefore, portion controls and costs can be offset. Very different than what Ellen had talked about and alluded to. High energy or energy dense foods, those tend to be processed foods, where nutrient dense foods tend to be healthier options have slower controlled impact on your glycemic index, and deliver a different healthy yield in the long run. I think subsidized healthy alternatives are a great way to entice the risk-averse crowd. Sampling is the way to go. Sample, sample, sample whenever you can, and really let the food speak for itself. Pairings, a great place to start. You know, maybe someone doesn't want to jump off the steak and cheese wagon right off the bat and go to the tofu stir fry, but you know what? Their sides, their beverages. You know, the center of the plate isn't always the entire meal. How do you begin to make a positive impact? I think pairing in meals is very important, whether we're bundling canned fruit or in-house prepared healthy sides or snacks, homemade specialty beverages and agua frescas as a way to introduce healthy alternatives that are also cost-effective is a smart starting. We want to be approachable. You know, information's key. Customers want to be self-aware, but they also don't want to be preached at this time of day. It's their personal time, so how do we provide subtle, suggestive, consistent messaging? Needs to be available, and not just at the lunchtime or at the breakfast meal time, but in shoulder periods. That snack time of the day. That's generally the crutch for a lot of folks, where you're doing well before 1 o'clock, and between 1 o'clock and 4 o'clock, you lost your way. I think appeal is also very important. If a food looks delicious and smells delicious, most likely it will be delicious. I think the staging, delivery, how they're merchandised, how they're promoted within the servery are extremely important. And last but not least, most important, offerings have to be delicious. You know, no one's going to take two chances on their lunch meal if they're spending $5, $6, $7 and find out, well, you know, that wasn't really good, and maybe you lost them for a week or two. So healthy alternatives really need to balance flavor profile, texture, seasonality, and really understanding and communicating with the demographic in every facility, and understanding the flavor profiles and desires are really what our focus